Doctors have read it. What is your most heartbreaking diagnosis? I work in rural medicine now, but prior to that was in hematology, clinical and lab. So many a Schmitty leukemia diagnosis, plenty of young and old dead adults. But perhaps one of the most heartbreaking things I had to do was when I worked in the lab. I got a call in the middle of the night from one of our scientists with a blood sample they'd received from a rural doctor and had arrived quite late, from a 5-year-old, I think. But when it went through the machine, it had some worrying counts. So the scientist had a look at it in the middle of the night rather than in the morning. They were concerned enough to get me to take a look and emailed me a bunch of photos taken of the slides. Absolutely raging leukemia. Cancerous cell counts, massive. Normal cell counts, absolutely tanked. High risk of them just spontaneously bleeding in their gut or brain. Something that had to be dealt with right now. But the doctor who requested the bloods couldn't be contacted. So I tried to call the parents, as this kid needs to not just be in hospital ASAP. They need transfusions and to be on a plane to fly about 1,000 kilometers to a specialized PAIDS hospital ASAP. Alas, I couldn't get the parents on the phone either. So I called their local ambulance. I sent them at about 1 a.m. to go bash on their door until someone answers and take that kid to the local hospital. In the meantime, I'd be arranging their medical flight to the city, got all the people along that chain on board. All of that went as smoothly as one could hope. But it broke my heart to think how traumatic that would have been for that family. It's bad enough to learn your kid has such a terrible disease, but to learn by red and blue lights and someone bashing on your door at 1 a.m. Story 2, dentist here. 18-year-old kid needed either dentures or $30K for a full mouth of crowns. He had genetic enamel hypoplasia leading to soft enamel, and his teeth had eroded to little nubs. When I presented this info to him and his parents, they laughed at the idea of spending that much on his teeth and said, "Well, it looks like we are letting them fall out and getting you dentures later." He seemed genuinely distraught. I felt pretty sad about the case. So I called them a few days later, offering to do the case as a charity, and I would charge nothing. They said they would consider it, but never called me back. I tried following up, and they didn't return my calls. This was a year ago, and I think about it a lot. Story 3. My dad is an oncologist. He told me about a woman who declined treatment because her husband threatened to leave her if she lost her hair. He was the only family she had, and she didn't want to lose him. My dad tried to reason with her. He asked if he could talk to her husband, who didn't come to the few appointments she attended, but she refused and disappeared for about 6 months. Then she came back because she had begun to physically decline, and her husband had left her. She wanted treatment since she had nothing left to lose at that point. But the disease was too far gone, and she didn't make it. She was 25. That's definitely one of the more devastating and infuriating stories he's told me. Edit. Arguably the worst part is that this isn't as isolated an incident as you might think. The whole reason my dad told me the story is because someone told a very similar story on Reddit. I mentioned it to my dad, and I said, "I think it must be fake, though. No one is that evil." Which is when he told me he'd seen it before, and more than once. Story 4. When my ex-mother-in-law was given 6 months to live with lymphoma, there was no one who spoke Spanish, so they told my ex-wife when she was 6 years old to explain to her mother she had cancer and only 6 months left to live. Story 5. I do a lot of trauma, and telling parents that their kid died due to stupid decisions is no fun. Lately, we had a lot of kids die from climbing on top of trains and getting electrocuted, so please stop doing that. Story 6. I'm an anesthesiologist, and I had to talk with a patient about anesthesiology risks. The patient was an orphan, 11 years old. Normally, I talk to parents when it comes to children. But this one gutted me because I read the patient's documents, and her dad had an accident at work and is mentally impaired, and her mother left her to go back to her home country. She came with 2 workers from the orphanage who were hardly 20, basically 3 kids in my eyes. Until this point, I never thought about orphans needing medical care because it never dawned on me. But goddamn, I needed a pause after this. Story 7. Junior on an Edward. My boss gives me an easy case to start off for a man who comes in with a headache and slow speech. I learned the man recently had his daughter die from cancer. Boss thinks it's depression. Examining him, something is definitely off. I order a CT scan thinking it could be a stroke. Brain cancer, dead within 1 year. Leaving behind his wife and 18-year-old son. Life is precious. Story 8. An ER nurse. I absolutely hate when we find cancer in someone who comes in due to some vague symptoms, whether it be blood in the urine that turns into bladder cancer, difficulty urinating that turns into prostate cancer, or we do a belly kit and see nodules on the lungs. The worst part is we don't know 100% if this mass on spot is cancer. We can just tell you about it and have you follow up. I can't imagine the stress waiting to know for sure how bad it is. My worst was a woman in her early 30s who had just beat breast cancer. She was a widow with no kids, and her only parent had recently died of ovarian cancer. Saw her for abdominal pain and, on the CT, found an ovarian mass. When we told her, She just looked so alone and devastated. I am not a hugger, but she was definitely my longest hugs to a PT in my career. Story 9. TLDR. Most patients in the pediatric oncology ward, really. I remember my first time on that ward about half a year into my internship. I was tasked with putting an IV access in, and then to take a blood sample from this young and longtime patient of that ward, like many paid-once patients there, to send to the lab to get new blood to transfuse for her. To preface, putting an IV access is already much harder on kids than it is for adults, and if the kids are cachectic, super young, and their veins have been poked at for years and years for treatment, then that task gets exponentially difficult. At that point, I was used to kids who would cry and tear the room down when they even glanced at a needle. This ward was different. Me being more or less a very green, fresh doctor at the time must have seemed to be noticeably anxious, because this patient looked me dead in the eyes and in the calmest manner said, "Doc, don't worry, I'm not gonna fight you. This is just my life. Get it over with." She took the stick to her vein emotionless, then went right back to scrolling through on her iPad. That was when I understood her words, that normal life for them included getting needle sticks from unfamiliar doctors and nurses, hospital beds, having to hear other babies cry all day every day. All doctors get desensitized to some degree. It's part of the job. But to know that those kids get numb to all this truly broke something in my heart. Story 10. I'm not a doctor, but an occupational therapist. Had a patient who was clinically diagnosed with a stroke. No MRI. Given medication, sent home with family to check on him, and I saw him a few days later. He seemed worse than the report from the hospital, but I gave him some advice around managing his fatigue and helped him with a few tasks in the house, making a cup of tea, folding laundry. That was Friday. Monday, I called to check in, and he's doing worse. Has moved to his brother's home where someone can be with him 24/7. I go visit him on Tuesday at his brother's house, and he's freezing in the middle of sentences, not able to take his hat off, without multiple stops and starts. His brother had to feed him his breakfast. This is not a stroke. I send him back to the emergency room, and he's readmitted to the hospital. Within a few days, he's not able to speak at all. Within 2 weeks, he's gone. Took a month to get the final diagnosis back from the lab. Story 11. HPV-related cervical cancer in 40 Wives' lady, paraplegic due to an accident she had on her way back from her honeymoon. Not only he causes the accident, he left her 1 month later and gave her the high-risk HPV. He's the only man she has been with. Story 12. Patau syndrome. There's a group of genetic defects called trisomies, in where people have extra chromosomes. Most people are familiar with trisomy 21, Down's syndrome. But there are others like trisomy 18, Edwards, and trisomy 13, Patau. Children born with Patau syndrome don't have much hope of surviving for too long, even with medical treatment. Longest I've seen was barely over 2 months in the neonatal newborn ICU. There's been reported cases in where the patient lives for as long as 19 years of age, but those are very rare. In most countries, people are given the choice to abort these babies to save everyone from the prolonged pain and heartache. Abortion is illegal in my country, though, so I get to see the mom try her best to bring to term a baby with a death sentence. Story 13. 60-something retired nurse presented with rapidly progressive cognitive changes and odd movements. Workup revealed she had Creutzfeldt-Jakob disease. She was with it enough to understand the diagnosis and simply cried to her husband saying, "I'm sorry for what I'm about to put you through." She discharged on hospice and passed after a few weeks. 30-YO female came in with some mild difficulty walking and sensory deficits in her legs. We MRI her brain and spine to see these ovoid-enhancing lesions in her brainstem and cervical spine. She had recently emigrated from an underdeveloped country, making us think this was an odd presentation of an infection like tuberculosis. We performed a lumbar puncture and don't see any signs of infection or inflammation, so we have to enlist the help of neuroinfectious disease experts from other institutions to no avail. Over the 2 to 3 weeks she was in the hospital, she goes from walking the halls to a quadriplegic. Eventually, one of the lesions expands to a point where we can reasonably safely biopsy it. The biopsy comes back as glioblastoma. These types of tumors rarely present in the spine and brainstem, and there's nothing we can do to help her. She discharged home on hospice and died a couple weeks later. Story 14. I remember how my son's doctor couldn't properly speak while informing me of his leukemia diagnosis. He was his doctor since the day of his birth. My son was 9 then. It turned out to be AML. He beat it twice before sepsis took him from us in 2022. Story 15. During my time in the ER, I had a patient with metastasized prostate cancer come in with a severe headache. A CT scan revealed he had a brain bleed due to the metastases, and he likely had only a few days left. When I told him, he teared up and said he was supposed to get married in 2 weeks. So that night, another doctor and I decided to organize a wedding in the hospital. We got an officiant for the next day. His fiancée arrived that night. I remember them sitting together, holding hands, and watching the stars through the emergency room window. She spent the night in the bed next to him, and they held hands all night. They got married the next day, surrounded by a few friends and hospital staff. 2 weeks later, he passed away, married to the love of his life. I still get teary-eyed when I think about it. It was such a bittersweet moment, and one of the most memorable patient encounters I'd had. Story 16. Have a patient who is a quadriplegic, bedbound. She is currently 25. At 23, she had a post-drug reaction over the span of 2 days, which left her completely paralyzed, neck down. She was completely healthy prior, traveled a lot, did slam poetry, and was a beautiful singer with a strong voice. Now she is non-mobile. Her voice is a whisper, tracheal tube, and she needs someone to help with basic motor functions, like itching her own nose. She can't clean herself and therefore wears an adult diaper. She has not gone out to see the sun in 2 years, and by far is one of the most charitable, gracious, and kindest young lady, neuromyelitis optica. I always put an extra hour to the side for when I go to see her. We will talk, do our nails, or watch TV together. I've learned a lot from her. Her life previously, her family, experiences I could never imagine. I always tell my patients that they know their own condition better than I do as a doctor. They have lived it. They know their body better than I do. So, to please tell me everything, why they think they are experiencing their symptoms, and what they think may help them feel better. I ask these things before I impose any treatment plan, because everyone is so different. We find a treatment plan that works the best together. I love my job, I love my patients, I love helping people. These are the cases that have me awake at night with the heaviest heart. Story 17. Here's an additional layer from the physician perspective that most people don't realize. The nicer and more wonderful the patient is, the more likely their diagnosis is severe and devastating. There's no rationale behind this, nor am I aware of any data that supports this, but just about every single physician agrees with this experience. Story 18. 15-year-old kid had a headache and stuffy nose for a couple days. Mother thought he was trying to get out of school. Day 4 or 5, he was drowsy and not easily rousable, so presented to hospital. Intracranial extension of sinusitis, subdural empyema, dural venous sinus thrombosis, and evolving venous infarct. Large craniectomy to wash out the empyema and allow expansion. Developed large intraparenchymal hemorrhage following surgery. Next day, the empyema started collecting again, even with the open skull and drains in situ. More infarcts, now including in posterior fossa structures. A few days later, developed contralateral empyema, second large craniectomy, more swelling, more infarcts. Life support was withdrawn a few days after that. I think he went from healthy to dead in 2 to 3 weeks. I checked what the lab cultured. I can't remember them right now, but the kid had organisms I've never heard of. Real left field Schmidt. Given how septic he was, they probably couldn't even use his organs. Really sad case. Story 19. Came in with a sinus infection. Diagnosis was inoperable brain tumor with a lifespan of less than 6 months. That was 10 years ago, and I still think about that kid and his family. Story 20. 2 cases. 1. First week of my internship, picked up massive pulmonary embolism in a young PT. Didn't have facilities to operate, so we tried to manage him on heparin infusion, Clexane, etc. Had to watch him die. The heartbreaking thing was his mother thanking me for trying to save her son. 2. Massive cerebral hemorrhage in a diabetic PT with DKA. Consulted with seniors on how to manage him, and no matter what we did, he died. Got him out of DKA. He died to the hemorrhage. Edit. Majority of third world deaths seemingly occur due to lack of resources from what I have seen in my hospital, and lack of awareness. Edit 2. The most needless death that could have been easily prevented if the ICU resident had responded in a timely manner. PT came with GBS plus respiratory involvement. Means he couldn't breathe and needed respiratory support. I kept him on an ambubag for 3-4 HRs. Sent 3 calls to ICU for shifting of PT to ventilator support. Stood by the PT for 3-4 HRs, pumping air by the ambubag and suctioning the saliva, etc., since he was in complete paralysis. ICU resident walks in 5 minutes after PT died, and I declared the death to the relatives. Asked me where's the PE, politely told her that he died 3 minutes ago, and she may go back to her rest and chats with colleagues. The casual attitude some doctors have, forgetting that one day it may be their family in need of help. Karma always gets you. Story 21. Most recent one for me was minor stroke due to basilar artery stenosis. The patient had only double vision in the beginning, then progressively started losing sensitivity and motor function of his body until he was locked in. All this in a week time, and unfortunately there was nothing we could do. Stenting of the artery didn't work neither. In the end, he lost his respiratory function as well, and he died. The worst thing is the guy was 60. Never had any health problems. Other heartbreaking diagnoses are Huntington's disease, especially for the descendants, young onset Parkinson's, and other genetic conditions, where you diagnose not only one person but potentially a whole family. Story 22. Not a doctor, but ex-surgical tech. First wave of COVID shut down all non-essential surgery, including cancer cases. I specialized in gyno-NC. We finally got the approval to do this surgery on a 70YO female. Unfortunately, the case had been postponed for so long due to COVID that we learned 10 minutes into surgery that this lady was terminal. If we had been able to do the surgery 6 weeks earlier, she would have had a chance. Never understood why cancer was not deemed essential. I lost a lot of patients. Story 23. I'm a high-risk OB doctor. When I was a resident, we had a pregnant woman brought in by ambulance, found down in a pool of blood. She was about 36 years old, first pregnancy, about 32 weeks along, husband traveling for work. She had been on the phone with him, and he said she stated she didn't feel right. Then he heard a crash, and she wouldn't respond. When she got to the hospital, the medics had the Lucas CPR machine going on her, and she was white as a sheet. Put the ultrasound on and saw baby in an agonal heart rhythm, last stages before fetal death. Did a stat perimortem C-section right there in the trauma bay. First bloodless surgery I ever did. With the heart not pumping, people don't bleed in surgery. Got baby out, it went to the NICU on cooling protocol, but kept seizing due to anoxic brain injury. They withdrew care within hours, kept working on mom, but never got her back. Pronounced her after about 45 minutes. When the husband got there about 5 hours later, had to tell him about his wife and baby. I've never heard someone sound like that. Just complete despair. You could hear the brokenness in his screams. I was a new dad at the time, and took me a while to get over that one. Story 24. Not a doctor, but I occasionally looked after an airline pilot in his 20s, who had come for a tumor removal. Complete success, caught early. Was told he'd be in hospital for the weekend, home Monday. Alas, he got an MRSA infection, and the overworked weekend doctor didn't check his fever out. Monday rounds caught the fever. They started IV antibiotics immediately. Alas, it left him unable to move anything but his eyes. His mother worked to make up a communication sheet she left on his pillow. He had maybe 40 words made up he could use to chat to you. I used to take 15 or 20 mins to chat to him the odd time at work. Obviously very one way, but he could ask questions. If you told the story like a choose-your-own adventure. Just remember his mother caught me chatting one day and bought me a fistful of lottery cards as a weird thank you. I haven't thought of that in many years. Story 25. Recently had a lady show up to the hospital with 6 months of a cough and unintentional weight loss. She knew something was wrong, but had been putting it off while trying to care for her husband, who was undergoing chemo for stage 4 lung cancer. CT scan showed horribly advanced cancer everywhere. Lung, lymph nodes, bones, liver, etc. Absolutely gut-wrenching conversation. Probably won't ever forget that one. Story 26. Not me, but a GF of mine is an x-ray tech and got a young 12-ish kid that broke his leg in soccer come in. She's not a doctor, but absolutely knew when she saw it that this kid had some nasty bone cancer, and that's why his leg broke. The only thing she knew was that it was probably from some other cancer in his body that had gone unchecked until he was in that state. She was shaken up by it because the family was all joking that it didn't look too bad, and kidding with him that he'd dropped just to get the other team a penalty or whatever. Then an oncologist had to be called to talk to them. Story 27. I had this one patient, 38, 39 male, with underlying end-stage renal failure and very poor controlled diabetes mellitus, among other things. Had bilateral below-knee amputation, and he was legally blind, could only see hand movement like 10 centimeters in front of his face. He had exhausted all means of hemodialysis. What I mean by that is, we have to put in a fistula, commonly AVF, from where he could undergo hemodialysis, but all possible sites in his body had failed, all but one, by the neck. So, to make sure we got it right, we had to do it under fluoroscopy. Well, long story short, the procedure failed. So what did it mean for him? Death penalty. He cried when he knew of the result of the procedure. Then he asked my specialist, "Can I eat tame special local food?" My specialist said, "You can eat anything you want." Now you have to know he had been having ESRF for many years, which means many years of strict diet and water restriction. 500 millimol daily. This includes anything with water, not just drinking water. We were basically just allowing him his last meals. And so he ate to his heart's content for the remaining days that he had, which was a week. Story 28. I'm a physical therapist, but I once had a patient come in after a knee replacement that presented with weird neurological issues. I sent him back to his PCP who did x-rays, and found stage IV cancer had metastasized to his spine. He was all happy telling me about how he just retired a week ago at 67 and was getting his knees replaced through Medicare so he can finally start traveling and catching up on life. Really taught me that you should enjoy life as you go instead of holding out. Story 29. Not a doc, but used to teach lunchtime EFL classes at a hospital, and the heart surgeon comes in with a really long face. He had one kid come in who had no real symptoms, but the valves into his heart were narrowing, so without surgery, he was doomed in the long term. So they decided to cut out one small valve and one big valve and transplant the big valve to where the small valve had been removed and put an artificial valve where the big valve had been. At least that was the gist of it long time ago, and I don't know medical terminology at all. The transplant didn't take, and the kid died. He'd just come in from an hour of the parents screaming at him for killing their kid. They were taking it especially badly since the kid wasn't displaying any symptoms before the operation. And this guy was really good at his job. He had awards for open heart surgery on premise and did a successful heart and 2 lung transplant of a woman who had lung cancer spread of her heart, but everyone has things go wrong. Just know I could never do a job where the off days are people die. Really didn't know what to say to the guy. Story 30. I'm not a doctor, but the story of my best friend's sister is especially tragic. She was experiencing painful cramping and heavy menstrual cycles. She had an IOD and went to have it removed, but they couldn't even see it. Her cervix looked like cauliflower. It was uterine cancer, and her fight began. About a week later, she was walking in a store with her mother and was very short of breath. Her mother, who was an RN, called the doc and got her in for a chest CAT stat. Sure enough, it had spread to her lungs. She went into the hospital, ended up on a vent, and was put into a medically induced coma. Everywhere they tested, there was cancer, and she was dead within 11 days from diagnosis. 11 days. She was 27. Story 31. Palliative care doctor. From a symptom standpoint, late-stage upper GI and pelvic cancers are the worst. It's hard to get people truly comfortable with those types of cancers. Not impossible, but hard, and it tends to be a moving target in terms of med dosages. And it's pretty heartbreaking when you have someone who is close to the end that you can't get comfortable for patients and families, and also for the care team. Graphic description below elaborating why I hate them. Proceed with caution if you're squeamish. By upper GI, I mean cancers in or around the stomach or upper part of your intestine, in particular pancreatic, gastric, and biliary. People get a lot of stomach irritation and can get obstructions so that their gastric contents just pool in their stomach and come back out the other direction. They also tend to be very, very painful. A lot of people with those types of cancers ultimately die of gastric outlet obstructions. Everything they eat just comes right back out, and even when they don't eat, they just vomit up their stomach contents. We usually end up putting a tube either in their nose or directly into their stomach to drain the stomach contents to keep them from vomiting as much. But it's still a pretty miserable way to go. TPN, IV nutrition, doesn't work well in that population once they've gotten to the end stages where they can't get chemo anymore. Can go into reasons if anyone is interested, but would be too much of a wall of text for this point. Pelvic cancers suck because there are tons and tons of nerves in your pelvis. So people tend to get a lot of pain from direct nerve irritation that's hard to control. They can also cause obstruction from the other end. So same deal as upper GI, only poop gets made in the lower GI system. So if you get an obstruction down below, you may be vomiting poop. Also, pelvic tumors tend to be oozy, so people get very unpleasant rectal or vaginal discharge, depending on where the tumor is. It also tends to smell bad, which people have a hard time with psychologically. Cancers both places also tend to like to spread to the lining of your abdomen, which can affect the way that food moves through your intestines and cause obstructions that way. It's also pretty irritating to your intestines, so people with spread to the lining tend to have lots of nausea and vomiting and overall gut unhappiness. Added a bit of clarification about TPN. Story 32. I started to work at my current hospital as a bright, shiny new doctor ready to fix people. In the first month, I had a 24-YO female present with ovarian mass, only one isolated to her uterus. Bad news with good outlook, got her set up with my buddy from residency for oncology, and saw her when she was admitted for hysterectomy. She was sad about losing the ability to have kids, but family was super supportive. She did well after the surgery, and we always talked about our favorite show at the time, The Office. Fast forward 4 months later, she's back with findings of a single metastasis in her lung, and she needs chemo at this point. She has a binder and schedule of her cancer treatment at her bed at all times, and was excited to tell me how she was going to beat this. I was excited for her, and her surgery went well, and she tolerated chemo very well. So things were looking up, and again, I was able to discharge her. And again, I always spent a bunch of time with her while she was my patient, and we had a lot in common. Half a year later, I see her dad in the Walmart, and he informs me that she had more mets, this time in the lung again, liver, and brain. I'm devastated. 4 weeks later, she comes into my hospital again, this time for confusion, pneumonia, and hepatic encephalopathy. This time, she was admitted under comfort care, minimal intervention, since she didn't tolerate the chemotherapy. We clear the ammonia out of her system, but her memory is permanently affected because of the brain mets. She recognizes me and still has her binder schedule, but she thought it was early the previous year and didn't realize she was terminal. So every day I would have to see her, and she would tell me about her cancer plan, and I would have to remind her that she was terminal and that the cancer has spread to her brain and liver and her memory was impaired from it. Every day I would have to destroy this poor lady's outlook, hope, and after 3 days, I simply couldn't do it anymore. I had a family meeting, and the rest of the family agreed that the best course of action moving forward was to keep up the charade and tell the patient she will be getting out the hospital soon, so we could resume her chemo shortly. At this point, she was jaundiced and emaciated, so very, very poor outlook. 2 days after that meeting, she went hypotensive and died presumably from a liver bleed. I can't listen to the office opening theme without thinking about her. Story 33. Had an 11-year-old avid piano-playing patient come into the ED for difficulty playing the piano for a week, totally healthy prior, ataxic on exam. CT showed a diffuse pontine glioma, which is a brain cancer with a 0% survival rate. Telling the parents that their child was going to die within a year was one of the hardest things I've ever done. Story 34. Not a doctor, but my brother had OI, brittle bones, helmet, splints, spinal surgeries, rods in his legs, walkers, wheelchairs. He went through so much, but the doctors told my parents he'd only live a couple months, and he lived 15 awesome years. Only passed after someone stole his wheelchair, and he fell, broke his hip. Story 35. Oh boy, I have many of these. Sorry for bad English in advance. We were managing ICUs in COVID-19 with a team of doctors. Our team went in shifts with an emergency medicine specialist and an internal medicine specialist. Before our latest shift, me and my buddy had a rough FIFA session on our Ps, lots of shouting, swearing, etc. Then we went in the IQs for a very chaotic 8 hours. After a very difficult intubation, we both knew we were messed up. We both diagnosed each other with COVID, laughing, comparing our CT scans. We were hospitalized in our hospital on the same day. It was early COVID, so the treatments were still in discussion, and there were no vaccines available. I somehow got better after 2 weeks of choking in my own breath. My buddy, he did not. R.I.P. Dr. Mehmet Ertain, you're not forgotten, my brother in arms. Then it's February 2023. My town, Hatay, got hit with the worst earthquake in decades. Nearly 30,000 dead just in Hatay. It happened at 4 a.m., and I was the first specialist that could arrive at the hospital. Roads were destroyed by the earthquake. By 5 a.m., all our equipment was already depleted. By 6 a.m., our morgue was totally full. By 7 or 8 a.m., some people brought me a girl of 17 and 18 ages that I sometimes see in my neighborhood. Didn't know by her name, but she and her family were familiar faces, which got impaled by an iron construction spike, entering from her back and exiting from her chest. She was gasping terribly for breath. She knew she was going to die. Her family knew she was going to die. Yet it was my job to pronounce her dead, and I still couldn't forget her look while trying to take a breath. Story 36. I had to break news to a 21-year-old girl who had just gotten engaged and about to get married that the lump in her breast is cancerous and it has metastasized to her bones, liver, and lungs. It was an extremely schmitty day. Such days eventually compelled me to move away from clinical oncology to research. Story 37. Diagnosing a 16-YO with advanced heart insufficiency with a need for transplantation. He used to be the soccer star of his city and had already been scouted for the sub-18 team for one of Brazil's big teams. He's lucky if he's still alive by now. Story 38. Not my own, but of a friend. He had a guy coming in feeling really bad. Turned out he came home drunk and got into the tub in way too hot water. All he could do was tell him to get his stuff in order. BC was gonna die in the next 2-3 days due to burning more than 90% of BS body. Guy was basically cooked. Story 39. Not a doctor, just a personal story. My sister-in-law had been diagnosed with synovial sarcoma about 6 years ago. She had been going through chemo for some time and had been getting lots of blood transfusions because she would get bloody noses that wouldn't stop. One trip to the hospital late at night, the doctor had apparently misread the file or didn't read the correct one. But when he saw the blood test results for white blood cell count and ran a couple more tests, he came in to tell her she had cancer. She got a good laugh and told him she's known for a minute. The initial reaction he had was great, pure shock. when she started laughing. The somber look he had coming in and then the laugh he got when she laughed was good. She lived for another 3 years before she passed. It's been sad watching my brother cope, and I don't know how to help, but he's come a long way and is doing well. Edit. Added words to make sense after getting some sleep. Story 40. Labor nurse, sorry, not a doctor, went down to the ER to meet an ambulance with a 29-week pregnant abdominal pain patient. Wasn't in labor. Diabetic ketoacidosis. I couldn't find the baby's heartbeat, but she insisted the baby had been moving all day, and she had an ultrasound the day before. Ultrasound confirmed the baby had passed. Transferred to higher level of care. Poor mama had to be stabilized before they could deliver the fetus. First time I was present when the parents learned their baby was dead. I don't recommend the experience. Story 41. My daughter was diagnosed with metachromatic leukodystrophy, MLD, just before her 3rd birthday. She was losing milestones and had pain in her legs. We had gone to an out-of-state neurologist for answers, when doctors here couldn't figure out what was wrong. It's a recessive genetic disease, and it's pretty rare. It's neurodegenerative and terminal. She did the test for it just to rule it out as she thought it was so rare. There was no way she would have it. She was diagnosed just before COVID. I remember the neurologist calling to tell us because she didn't want to wait for us to make the drive out of state again. She cried with us on the phone. I have so much respect for that woman to this day. Edit. Disease information clarification. Story 42. Family doctor here. Used to be a hematologist. During those hematologist years, I had a patient come during my shift. She was a 20-years-old girl that had a striking resemblance to my girlfriend. Similar name, background, look, etc. She had full-blown leukemia, an aggressive AML if I remember right. She was very weak, with gum infections and such. We treated her infections quickly and started her treatment ASAP, together with blood transfusions and such, and for about a month, everything seemed fine. She became happy and energetic, but her cell counts just didn't rose back. It remained nearly 0 lymphocytes. I went on a 2 weeks paid leave, returned, and found out she died immediately after I left from a sudden and aggressive pneumonia. I got sick soon afterwards and had to change my specialty. She was just one out of dozens that I lost. All tragic. Story 43. Not a doctor, but we'll share a story from a doctor. I worked as a civilian in DOD and spent a lot of time with senior officers. 2 USAF colonels were trading war stories. One was a navigator, the other a flight surgeon. Both had 06 level command, etc. Navigator asked the flight surgeon what was the toughest thing he ever had to tell one of his airmen. Flight surgeon went on to tell a story about a depressed airman under his care. He was homesick and lonely. Decided the best thing for him to do was take an entire bottle of Tylenol. Although it was an attempt at suicide, he did not want to die, was just making a cry for help. So he took the Tylenol, got incredibly sick, but did not seek treatment within the window that acetaminophen poisoning can be treated and reversed. By the time he got help, he had a change of heart and decided dying was not what he wanted and sought help. By the time he was in the care of the flight surgeon, he had to tell him there was nothing he could do for him. His liver failed and would likely die in within the next 48. I heard a lot of war stories, but that one has stuck with me. Story 44. Not doctor, but nurse. One had a 19-year-old come in who hung herself on New Year's Eve. Dad found her. She became completely in a vegetative state. All she could do would moan in pain all day long, no matter what we gave her. She eventually went to care home and died months later. 2. 20-year-old went on holiday with his mates for the first time. His mate had an argument with someone in a club, and he stepped in to protect his mate and got hit in his head in the wrong place. Again, vegetative state. Mum was broken. 3. Guy goes to China after getting routine shots, but when he's asked if he wants ones for extra rare things, he declined as it is very rare. Poor kid got bit by a rare mosquito, paralyzed him head to toe, and was completely incoherent. He was 19. 4. Community nursing. Went to a lady in her 40s dying of cancer. She was declining rapidly, but wanted to be at home. Her partner left her when he found out she had cancer, and she was left alone to die with just us coming every day. Week after she died, we saw his car back on the drive when on another call. I could go on forever. Story 45. Had diagnosed myocardial infarction in a 40-year-old in my internship. He survived after some efforts and was well into recovery. On 4th day, the nurses forgot to give him lactulose, due to which he passed away during passing stool. I had no idea how to feel. The relatives were in even worse condition as he was the only earning member of family. Story 46. I'm a radiologist. My wife was nearly 20 weeks pregnant with an ongoing subchorionic hemorrhage, and I was monitoring with ultrasound pretty much every other day. One day we go in to scan, and all the amniotic fluid is gone. My heart sank the moment I saw that. I let her know, and we walk over to the emergency department. A few hours later, we have a miscarriage, pretty much as late as you can have one, without the possibility of survival. Story 47. Not a doctor, but my BFF is, and she showed up at my house last fall, full-on sobbing after diagnosing a kid. with Sanfilippo syndrome. It's childhood dementia, Alzheimer's, where very young kids suddenly stop hitting milestones, then backslide on all milestones while sliding into dementia, losing the ability to speak or comprehend the world around them until they eventually die. Basically, your kindergartner stops hitting milestones. You freak out, and every doctor tells you are just a helicopter mom, and you stress out for 6 months while everyone calls you paranoid, and then you get a death sentence diagnosis and spend years watching everything you love about your child slide away from them, leaving an empty shell of a body. Story 48. I work in a psychiatric ward. I had a patient who was 20 and was diagnosed with schizophrenia. Before it was full-blown, he was an engineering student at the top of his class and had the world going for him. His parents would visit him and his mom would often cry. His affect was very flat, and he always seemed agitated. You could tell he was constantly tortured by internal stimuli. Sometimes he would bend over and scream in his chair, but nothing would come out. He would then sit back up, face strained and red from the blood flush, with tears in his eyes. I saw him a few months ago on a different unit. He seemed to be a tad bit more social, but still flat overall. He remembered me and I told him that I thought of him often. It's devastating what mental illnesses can do to people, and how it can destroy families. It's also extremely annoying to see TikTok teens diagnosing themselves with schizophrenia, but being completely fine. Granted, some may have schizophrenia, but others definitely do it for clout to be edgy, or may have something completely different. Story 49. Not a diagnosis for me, but the first time working in a children's cancer hospital watching a young girl, couldn't have been more than about 6, pushing her own drip through the hospital on the way to lunch. Broke my heart, and it's an image I'll never forget. At the other end of the spectrum, you also see how many older people die in a pretty undignified way. And it's easy to forget sometimes that they were living full lives like myself and our colleagues at an earlier stage of their life. It makes you think. Story 50. Not a doctor, but I did work with medical insurance, and I will never forget these 2 calls. Telling a couple that infertility is not a covered benefit, and the worst, explaining to a grieving mother that because her baby was dead at birth, the insurance company was not responsible for any costs thereafter for baby, including infant autopsy and burial. Those were hard. 12 years ago, if that was you, I still think of you. Story 51. I work as a pediatrician. The worst case I've seen was a young boy who was hit by a car on his way home from school a few days before Christmas. The pressure built up so high in his head due to bleeding that his brain herniated through the bottom of the skull. When I went to tell the parents, I asked them to sit down because I had terrible news for them. The parents were divorced, and the father refused to sit at the same table as the mother. I again invited him to sit down because I had sobering news, but he refused, saying, I won't be next to her. So I delivered the news that their son was dead, and we would be stopping CPR while the father was standing on the other side of the room. We gave the parents the opportunity to see their son's body, and they sat down on the same couch together and held him. It broke my heart. Story 52. Childhood cancer is the worst. When my son was going through radiation therapy, astrocytoma stage 4, our doctor, Donna, was a pillar of strength. She kept positive throughout his treatments. She came to his school to talk to his schoolmates about his condition. She was a super doctor. One day while leaving the hospital after his treatments, we had a long wait for the elevator, and my son got impatient, so we took the fire escape stairs down. I saw Donna crying in the stepwell by the door. Story 53. I'm a psychologist, so the worst is diagnosing dementia for me. I do neuropsych testing, and many people get very agitated during it because they know they aren't doing well. When the feedback session comes, it's confirming all of their fears. I think vascular dementia is worse for the patient than Alzheimer's, because it's a more sudden loss of capacity in a stepwise pattern, whereas Alzheimer's is more gradual. I haven't seen Lewy body dementia in person yet, which I bet is worse. Story 54. Not a doctor, just a lab tech. Had a 11-year-old child CSF come in for urgent acanthamoeba PCR testing. Partway through extraction, we got a call from the hospital saying not to worry about testing anymore, as he had sadly passed away. He was indeed infected with acanthamoeba. Stay away from stagnant water in rural areas. Story 55. When I was a resident, we rotated through GYN oncology as part of our curriculum. I was at a large county safety net hospital. I saw horrible cervical cancer in young women, metastatic ovarian cancer in pregnant patients. You would go home in the evening and come back the next day to find your patient had passed. I will never forget a night in ed when we had a patient in her 20s come in for a second opinion because she was diagnosed with an ectopic pregnancy at another hospital, but was a virgin. We repeated all the tests, which were concerning for metastatic ovarian cancer. She was hospitalized after her first round of chemo due to complications and ended up having intestinal perforation. The attending tried to operate to save her, but her family ended up withdrawing care, and she passed away in the ICU. I won't trade my experience and training for anything, as it was insurmountable in making me the doctor I am today, but the number of young women I saw die will never leave me. Story 56. The younger the person dying, the worse it is for me. I do adults only. Had a 20-year-old nursing student that stood out to me because her HCG kept being positive and her guy-in told her it must be retained products of conception, even though she said she's not sexually active, and the ultrasound was negative. I meet her when she gets admitted for continued vomiting and weight loss, and I find a massive gastric cancer. She got inpatient chemo started immediately, but was dead within a month. I hate telling that story. Story 57. Not a doc, but a PA in an ER had a 14 or 15-yo kid come in for a headache and vomiting for about a month or so. The pediatrician saw him sometime prior and told mom nothing to worry about. Mother never followed up. Vomiting started to get more frequent and more forceful. Lab work showed his kidneys were injured due to dehydration. I asked the kiddo if the headache started before the vomiting. He said yes, got the CT brain, and revealed one very large brain tumor and a couple of hard-to-see small ones. This means he has metastatic cancer. Sent him to Children's Hospital L. They scanned his belly and found tumors. Biopsy reveals kidney cancer. This was now greater than a year ago, but I still remember the look that kid's face and his mom's face when I told them. As I write this, I still tear up to this day. Working in healthcare sucks hard sometimes. Story 58. 35-year-old lady, married with 2 kids, presented to general surgery with vague upper abdominal pain. I sent her for an ultrasound, expecting it to be normal and send her home. The report came back as multiple liver metastases. I explained it to her, but mid-discussion, she said she wanted her husband with her and asked if I could wait. I agreed, and when her husband arrived, I broke the news to her. She had metastatic cancer, but we didn't know from where. I almost started crying in that appointment. I was destroying their life. I sent her home with MDT and outpatient oncology. I regularly kept tab on her to see what the biopsy showed, etc. A few weeks later, I heard she had been brought into hospital septic. She passed away later that night. I remember reading my consultant's entry into the notes and how he had to tell her husband and kids that their wife-mother was not going to survive the night. I'll never forget that one. Story 59. Years ago, I was still a student. I was working in a locked ward psychiatry for elderly folks. I had a nice colleague. She was working in the social service department. She has been there for more than 20 years and was about to retire within the next year. Always smiling, always happy, and trying to help everybody. Then she got Pix's disease, which is a rare form of dementia. Within months, she completely lost her personality and got insane, ending in the clinic she used to work in for decades. Horrible for everybody. Normally, you only know the patients after they got mentally sick, but this time, it was different. You learn to understand why some people simply can't stand it to see their loved ones in places like that. Story 60. Not a DR, but an RN. When I was in nursing school, I did my pediatric rotation at an orthopedic hospital, and there was a beautiful 16-year-old there with osteosarcoma. She had already lost both legs at the hip, and they were getting ready to amputate her arms as well. I was absolutely gutted when the doctor went in to tell her that. That was over 30 years ago, and it still to this day affects me. No, I don't know what happened to her. Pediatric oncology nurses are angels. I could never do it. Story 61. Not a doctor, but when I was in Peace Corps in West Africa, I volunteered to translate the local language for a team of American surgeons working in vaginal fistulas for women. Most of these women got fistulas from prolonged childbirth. These women were ostracized since the fistula would make it so they were either leaking urine or feces basically all the time. One woman had already had approximately 7 surgeries to try to close her fistula, necrotic tissue, etc. This surgical team had me translate to her that there was nothing else they could do. The repairs weren't working and she would have to live with the fistula for the rest of her life. She was probably in her 20s. I was her age. Story 62. I'm an oncology nurse practitioner and I've been practicing for a very long time. I'm used to breaking bad news to people and I'm good at it. I got a call from my boyfriend late at night last year with both his sisters on the phone. Their mom had stroke-like symptoms and that took her to the ED. They were telling me she had a 5-centimeter mass in her brain. I tried to say they needed diagnostics, but I knew what it was. A couple days later, when the diagnostics came back, I had to tell my boyfriend, now my partner, that his life was going to be very different and that his mom was going to die in less than 6 months. She passed a year ago this Friday. Wish I got to know her better. Story 63. I'm a resident, but there was a baby who was initially born across the street at the adult hospital and had Edwards syndrome, found to have severe cardiac defects with neurological impairments. Family abandoned him at the hospital, so he went into state custody and was placed on hospice. The children's hospital staff became his family, but the unfortunate thing was that he was always sad with a frowning face, crying whenever awake, even when trying to console. He eventually passed away in the hospital in his crib, but no family with the exception of the hospital staff. Story 64. Details slightly changed, but I diagnosed a colleague's wife with high-grade but treatable cancer last week. My colleague is the oncologist for that specialty. That wasn't an enjoyable multidisciplinary meeting. Story 65. I was 11 when my 4 older brothers were diagnosed with muscular dystrophy. It was a long, very slow, depressing march to the grave for them with a lot of suffering, capped with mom sliding into dementia after. I am adopted. Story 66. Not a doc, but X-ray tech. I was working in the ER and had an order for a portable chest X-ray on a patient who had shortness of breath. Guy was walkie-talkie and generally just concerned about his sob. I took the image and immediately saw his lungs just full of tumors. I had the realization that at that moment, I was the only person who knew he had lung cancer. It was very surreal. Story 67. Primary sclerosing cholangitis in a woman in her 40s. Husband and 2 young kids. She was in the hospital for assessment. Due to the PSC, she lost a lot of weight, and she noticed a lump in her breast. This was breast cancer. Treatment for PSC is a liver transplant, but you do not get one if you've been diagnosed with cancer. Patient was sent home with her terminal diagnosis. Heartbreaking. Story 68. I'm a dentist. Had to tell a 12-year-old and the patient's mom that every tooth needed to go, and we'd have to do dentures. Kid was addicted to fentanyl. Also, we sent a patient to a clinic for assisted suicide after they had a non-operable recurrent oral cancer. That was a rough conversation. Sure, these aren't that bad compared to some of what's in this thread, but for a general dentist, this is about as bad as it gets. Story 69. 7 or 8-year-old little girl fell at gymnastics, had an obvious forearm fracture. I was planning on having the cast versus surgery talk until I saw her X-ray. Pathologic fracture through osteosarcoma. Needed a dominant-sided amputation. Went from the most run-of-the-mill injury to one of the hardest discussions of my life. Story 70. I had a 30-year-old with metastatic melanoma. Came out of nowhere. He only noticed something was off because his leg started swelling. Imaging showed metastasis to basically every organ, and a biopsy confirmed melanoma. Unfortunately, it did not respond well to immuno or chemotherapy, and he died less than a year after diagnosis. He left behind 2 young daughters. It broke my heart every time I saw him. That was over 2 years ago when I first started practice, and I still think about him almost daily. Story 71. Hemorrhagic stroke is messed up, especially the massive one. Imagine telling your patient's family that he had bleeding in his brain so bad that he is 100% going to die within 30 days. One day he's fine with 0 complaints. One headache later, he's good as dead. Story 72. Idiopathic pulmonary fibrosis. Your lungs will turn to scar tissue slowly. You will be more and more breathless by the day until you suffocate. No therapy available. Transplant only resets it. After we knew the diagnosis, but before we told him, the guy kept telling me every day, "Hey doc, I'm feeling better. When can I go home?" After the news, we sent him home with oxygen tubes. When they were no longer enough, he was to come back and be given morphine to die peacefully. Story 73. Oof, I just delivered it earlier this month. 50-something female with no significant medical history was referred to cardiology because her EKG looked suspicious at her doctor's office. We get an echo, and her EF was 20%, so she's in severe heart failure. For no obvious reason. It's so low she's at risk for sudden cardiac arrest, so I had to get her a life vest, which straps to your chest and shocks your heart, and the high chance it goes out of rhythm while we wait for further tests. I cried all weekend. Story 74. Not a doctor, but I've got one. My dad's friend was a surgeon. He walked into the doctor's lounge and saw a colleague studying a chest x-ray. He took a glance at it over his shoulder and offhandedly said on his way out, "Geez, that's too spread out." I wouldn't even bother opening them up. Turned out the colleague was diagnosing himself and looking at his own x-ray. Story 75. I saw a woman for swallowing difficulties. She had changes in her voice and examination that made it very likely she had ALS and would worsen pretty quickly. That alone is bad, but happens not rarely. But she had a young adult son with Down syndrome and no other family to take care of him. He was so lost and confused to have to live somewhere other than home. Her last memories would be of seeing the son, who was her entire focus, completely fall apart. Story 76. When I was a resident, I took care of a lady with postpartum cardiomyopathy. Basically, her heart was failing after giving birth. She was young and had 3 kids and a husband. Her heart kept stopping on us, and we had to continue bringing her back with shocks and compressions. We eventually put her on VA ECMO, which is basically bypass assist for the heart and lungs, and was able to stabilize her to get a heart transplant. She lived. Story 77. Healthy middle-aged woman came in after she felt dizzy and almost fainted. Noted a very small spot on her ear, which she told us was melanoma, which she'd had for a year but hadn't had removed, as she was waiting to go to a specific doctor for cosmetic purposes. Found out mets to brain, and the oncology doc said she had maybe a couple months as it was everywhere, and was surprised she hadn't had more symptoms. Still think of her every so often. Story 78. As a medical scientist that worked in the blood bank, the most heartbreaking moments were when we'd have a regular blood order for a specific patient, usually with leukemia, and then suddenly it was canceled. You knew they had passed away. A bittersweet moment was when you'd get a request for blood for a heart, lung, etc. transplant. While it was great someone's life was being saved, you knew it was because someone else had died. Story 79. Been in neurology a while. Sure, ALS is awful while it lasts. A malignant brain tumor is no joke, but I think my vote goes to Parkinson's disease. No other disease that I'm aware of tortures a patient and their family quite so hard for quite such a long time. It's probably worth knowing that most neurologists don't believe Stephen Hawking had ALS. Mean time from diagnosis to death is 6 to 12 months. Story 80. My dad started experiencing symptoms: weakness, weight loss, loss of motor function. I helped him through the system, but realized way early he had ALS. Early on, I'd promised never to lie, not even by omission. The only time I have ever seen my dad cry was when I told him, "It is the hardest thing I have ever had to do." Story 81. Not me, but a cousin who's a doctor, working trauma on a Saturday night. At a wedding, the guests were making their way to the venue after the church service. Mom of the bride died in an accident on the way there. I can't imagine the pain that the couple, especially the bride, has to go through, especially during anniversaries, etc. Story 82. 18. Yo came in after a car accident, went in to repair some lower body fractures. She lost a lot of blood during the surgery and woke up completely blind in both eyes. There was a lack of blood flow to the optic nerve eyes, posterior ischemic optic neuropathy. I'll never forget her. Story 83. When I was shadowing as a student, a patient had come into our infectious diseases clinic thinking she'd got Lyme disease. Doctor did a load of tests, noticed a neurological deficit, sent her for a scan, brought her back 4 days later to tell her she was referring her to neurology for multiple sclerosis. She was 18. Story 84. When my wife was in med school, she was doing a rotation in hematology, oncology, and on 9/11/2001, she had to give 2 teenagers diagnoses of leukemia. She says it was just surreal. That has stuck with her.